Hello, I'm Esther Gidhu. It's Friday, April 3rd. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. The global coronavirus pandemic has reached a grim milestone, over 1 million confirmed cases. It took 76 days from January 10th for the first 500,000 COVID-19 cases to be reported, but that number doubled in the next 8 days, according to Reuters. Johns Hopkins University says more than 25%, 236,000 of the cases are in the United States. The worldwide death toll stands at more than 53,000. Italy is reporting the most fatalities with more than 13,000. As the coronavirus spreads across Africa, many countries are responding aggressively to flatten the curve. Regional experts say a widespread pandemic could cripple the continent's fragile healthcare systems and be devastating economically. Africa 54's Paul Ndiho spoke to Dr. Amit Thakker, the Nairobi-based chairperson of the Africa Healthcare Federation. Thakker says that Africa needs a united approach in dealing with COVID-19.
We've seen what developed countries are going through, and now that we have the virus in Africa with about over 5,700 cases, some countries have more than the others. I think everyone, government, private sector, civil society, development partners are all on the forefront and preparing to ensure that we flatten the curve. As you know, the ability of our health systems is even weaker than many of the countries that have faced high levels of mortality.
How much, in terms of preparedness, do you think our countries or African countries have done?
I think they have really tried to prepare as much as they can. You know, the conditions are different from country to country. You cannot really copy paste what Italy does or Spain does or UK does in countries in Africa. We should scale up our preparedness, but let's look at Kenya, for example, where I am. Our president and the Minister of Health leading the government efforts are totally on the ball about what's happening on corona. The private sector has regrouped itself in an organized manner to provide the support it needs. And we know that it's only through the efforts of every citizen and every sector to make this coronavirus, to battle this coronavirus.
I've been home for the last 3 weeks, working from home. We can barely go out. I wonder how it's like on your end.
There are measures being taken to try and prevent transmission. As you know, in Africa right now, we are focusing on the big 3 goals. The first goal is prevent transmission. The second goal is prevent death. And the third one is preventing social harm. All our activities are geared towards these 3 goals. The coordination is at its highest at the national level. And right now, everyone is facing down in their own countries, looking at strategies, collaboration and cooperation to keep the numbers down and flatten the curve, as they say. But I must also let you know that Africa Union has also been working extremely hard to have a continental approach. The chairperson, Cyril Ramaphosa, the president of South Africa, announced just a few days ago that a continental approach is absolutely vital on the fight of coronavirus.
You spoke about funding. The U.S. government announced that it's going to maybe try to help some of the countries in Africa that are in a very dire situation. Some African countries have also received funding from different sources. Do you think this is really enough to tackle the kind of challenge that we're dealing with?
We need the support now, not later. I understand that these calamities are affecting many countries around the world. But we need that support, and the funding is literally not enough.
What do you think can be done, at least to mitigate or not replicate what we are seeing here in the United States and in Europe?
I agree, we have to scale it up. We have to have public messaging. We need to really convince people in Africa that this is real and change their mindset about coronavirus and its impact.
Do you think that some of the measures that have been put in place by some of the presidents on the continent to stop the transmission that you're talking about are going to be effective?
It's already working in some cases. I can tell you that when we stopped the import, or we stopped the flights, we probably stopped a lot of imported cases. When we started teaching or showing everyone about hand washing and social distancing, I think we've made an impact, but it's not enough. Africa needs the support, and Africa requires a united approach in dealing with COVID-19.